Hello, friends. Today I am going to be going over a very sad and tragic story about the death of a Texas anesthesiologist that was caused by another anesthesiologist. Before we get started, I'm going to give people time to log in. Before we get started, let me know in the chat where you're watching from. And also let me know if you've heard of this story. All right, so let's get started. Like I said, if you want to leave me a comment in the chat in regards to where you're watching from, or if you've heard about the story, feel free to do that. So let me bring this over here. Let me share the screen. There we go. So an anesthesiologist was arrested for tampering with IV bags, and it was implicated in another doctor's death. So what happened is that this anesthesiologist here was putting bupivacaine, which is an anesthetic agent, as well as epinephrine into IV bags. And another anesthesiologist had taken a bag home with her. And hi, thanks for watching from Philly and Utah. Yes, it is super scary, Saneda. So, and keep watching because unfortunately, this happened in Texas, and there's another physician in Texas that was practicing at the same location that also is responsible for atrocious acts. So I want to discuss today, could this have been prevented, right? There were plenty of red flags. Is the Texas Medical Board being too lenient toward physicians? We'll always remember to be civil to each other in the chats, but I do believe that the Texas Medical Board needs to have revisions, and they need to hold people accountable earlier on before these tragedies are occurring. So federal authorities arrested Richardson. He was an anesthesiologist, Dr. Raynaldo Ortiz, on criminal charges for tampering with a consumer product causing death and intentional drug alteration. Now, he had in August, an 18-year-old patient had experienced a cardiac emergency during a routine sinus surgery. So he was tampering with IV bags, but was not using those IV bags during his own surgery. It was occurring during other surgeries. However, 10 other incidents occurred at this facility in which patients experienced unexpected cardiac emergencies. And the reason why they were experiencing these cardiac emergencies is because the large quantities of bupivacaine combined with the epinephrine was causing these people to have cardiac arrhythmias and go into cardiac arrest. So how are there 10 incidents at this facility, and this facility doesn't stop to investigate and say, hey, what's going on? And the facility is Baylor, Scott, and White. So if anybody is watching, hi, Luce. Exactly. Zanela is saying she feels like that is a big red flag. So has anybody ever heard about Baylor, Scott, and White and the other? It was a surgeon where also people were dying and experiencing awful outcomes at the hands of a certain physician. And it's actually a series that's out now. So let me know. But anyways, so a few red flags that were missed. So 10 other people had adverse outcomes, cardiac arrhythmias. An 18-year-old coded. Then he developed heart failure. I pray to God that he's going to be okay. But and the only reason that I believe they finally investigated is because another anesthesiologist had sudden cardiac arrest. So the Melanie Kasper, who worked at the center, died after taking an IV bag of saline solution to administer at home. Her initial cause of death was heart attack. Following an autopsy, the Dallas County Medical Examiner found the presence of bupivacaine, a nerve-blocking agent used during anesthesia that can be deadly when misused. Many IV bags used by patients with adverse reactions during surgery also had traces of anesthesia drugs that shouldn't have been present. So, if, like I said before, if these things are happening at this facility all of a sudden, why not stop to investigate? And these unexpected cardiac emergencies happened between May and August of 2022. Now, here's the kicker. A nurse who worked with Ortiz allegedly told authorities that he refused to use IV bags she had retrieved from the warmer. So this all goes back to intent, right? He knew what he was doing. He was intentionally poisoning these IV bags to cause these adverse effects in patients, potentially knowingly that they would kill them. And he knew enough to not use those bags during his own surgery. Now, he started doing this. The incidents began just days after Ortiz was notified of a disciplinary inquiry from a previous surgery years earlier. So he basically got disciplined by the medical board, and just a few days after, he started doing this. A previous surgery years earlier, where another patient experienced a medical emergency. So bear with me just 1 second. I'm going to share my other screen. I actually pulled up the matter of the license of him for this other. So let me see. Stop screen. Let me share the other screen. Share screen. Here we go. So this is in the matter of the license of Raynaldo Ortiz against the Texas Medical Board. And I've highlighted the most important things. So this is previous. This is previous to him sabotaging all these IV bags. He had received disciplinary action. The patient required exactly. And Sinead, I'm sorry, I didn't ask you, what are your pronouns? I don't know. I said she, but I don't know if you're he, she, they. So the only thing that I can think of, and let me know, like, what reason do you think this anesthesiologist would have to tamper with these IV bags and potentially cause the death of patients? And he wasn't doing it during his own surgeries. Do you think because he couldn't practice, he was trying to get to others, like maybe have other physicians get disciplinary action? I'm just trying to think in their warped way of if maybe, like, I'm just trying to think if maybe he thought that other patients were coding on other physicians, that maybe the board would not think that his patient's coding was that bad. I mean, I don't know. But so during this instant that he received this disciplinary action, the patient required CPR and emergent transport to an acute care setting. And what happened is that he had, so even before the IV bags, he received this disciplinary action. And then in 2018, he received another disciplinary action for the board found that the respondent failed to report his criminal arrest and conviction of cruelty to a non-livestock animal. And what had happened in this situation is that he actually shot a dog with a pellet. So that's a huge red flag. Animal cruelty in the DSM, which is the Diagnostical Statistical Manual, which is what psychiatrists and mental health professionals use to diagnose individuals with antisocial personality disorder or narcissism, things of that sort. And antisocial personality disorder, just a really quick background, that is what pop terminology will term like sociopath. So antisocial personality disorder, a huge red flag is animal cruelty. So they found out that he had done this. He failed to report it, but they still let him keep practicing. During this, so the findings of the panel at this time, exactly, Alfie says sounds like a serial killer. Exactly. So during this situation, the patient required CPR, and the respondent, which is the physician, did not respond to the patient's issues in an appropriate manner. So this patient needed CPR and the doctor didn't treat it like it was an emergency situation. The respondent failed to document the critical events. So basically was not charting appropriately and was minimizing what was happening. And the respondent did not recognize the patient's inadequate oxygenation and ventilation. So this patient's oxygen level was low and they were not breathing and did not recognize that. Now, and again, this sounds like what I will be talking to you about, that other physician that they recently made. I don't know, like if it was a year ago, it was a surgeon, but he did the same thing. That surgeon in Texas, in Dallas, the respondent relinquished his privileges prior to any hearing on the matter. Respondent was denied a fair hearing, which then resulted in the respondent's resignation from the hospital. So because he resigned, this wasn't his privilege, this wasn't reported. So the other physician also had resigned, and that's why he could go to like Baylor Scott and then to another facility. And then I highlighted this because to avoid further investigation, hearings, and the expense and inconvenience of litigation, like you have patients' lives in your hands if you're the Texas Medical Board, right? To avoid further investigation, hearings, and the expense and inconvenience of litigation, I'm sorry, but when people are dying, you need to be inconvenienced and you need to go to court and you need to do the appropriate proceedings. So that was that document. And going back to let me share my other screen. So I'm going back to sharing this one here. So Ortiz had a lengthy criminal and disciplinary record before being hired by Baylor Scott and White Surgicare North Dallas. And so Alfie is saying, let me actually start highlighting these comments. Sorry, I wish I had someone running my board because I feel like I'm trying to juggle so much stuff right now. But Alfie says, I hate to say it, but it's always the doctors or surgeons that are twisted. Unfortunately, there's evil in every profession, right? Nursing, every profession, even. Like, I'm not going to say it's just doctors. Of course, there's some awful nurses that have done despicable things too. So I just want to throw that out there. But what really gets me heated is the fact that he had been arrested multiple times for domestic violence. His privileges were revoked at least at one other surgery center. He spent time in jail after shooting a neighbor's dog. And he had been fined multiple times and disciplined for not notifying employers of past disciplinary actions. So this guy had a pattern of deceitful behavior, a pattern of animal abuse. He was also charged with domestic abuse. How is it that his license is not suspended before? How is it that he's getting job at other facilities? Thank you, LP. And I wanted to share real quick. Let me see if this catches up. So I'm a nurse practitioner. I'm also a nurse. And I know for nurses, like and this is in Florida, right? If we get a criminal record for a specific offense, so convictions include robbery, child abuse, possession of controlled substance, and domestic violence, we may be ineligible to renew our license in Florida. And that should be the way it is, right? So why is it that this person had so many red flags and was still being allowed to practice? I just don't get it. Now, after this incident, after this anesthesiologist died, they suspended his license. I'm sure it will get revoked at one point, right? I'm sure it's going to get revoked, and I hope he will do some prison time. I really do. But how is it that his license is not immediately revoked? I would like to remind you about the RaDonda Vaught trial. Does anybody remember or heard about RaDonda Vaught? Exactly, Suneda, especially in a big state like Texas. So does anybody, so RaDonda Vaught, in case that you're not familiar with what happened with her, is that she unintentionally, there was a lot of things that went wrong that day for her, right? She apparently, like, there weren't enough computers or scanners to go down to the place where she was going to scan a medication. She was training someone that day. There was a lot of things that fell through the cracks. She administered the wrong medication, a paralytic agent, to a patient, and they ended up passing away because of her medication error. Now, this was unintentional, right? She was charged, and forgive me, I don't remember the exact charges, but I think it was like unintentional homicide or reckless, something of that sort. And she was looking at jail time. Her license got revoked, and this was an unintentional error, right? So again, why yeah, that is our worst fear. That's a good point that you bring up, that as a nurse, that is our worst fear, to do something like that. And that's why I encourage you as a nurse, and nurses that are watching this in the playback, like, don't skip steps. Do your triple checks. Make sure that you have your scanner. Make sure that you're not distracted. All of those things, right? But my point is, why is it that her license was immediately revoked? She's looking at jail time, prison time, whatever. And like event, like the court found, they sentenced her to, I think, like probation or supervised probation or house arrest, something like that. She doesn't actually have to go to prison, but she was still charged, right? Meanwhile, we have this man shooting dogs, parading or domestic abuse, didn't follow protocols, didn't do CPR on a patient, has revoked medical privileges in other places. And I'm just going to say it now at this point, sounds just like um, Dr. Death, Dr. Dunch, the surgeon, the spinal surgeon, that botched so many surgeries and actually ended up killing a few people. Guess what? He also was a surgeon in Texas, in Dallas, and also worked for the same facility, Baylor Scott. So clearly something very negligent is happening in Texas, specifically Dallas. Why is it that so many events have to occur before people step in and they suspend someone's license? So, our complaint alleges this defendant surreptitiously injected heart-stopping drugs into a patient IV bags, decimating the Hippocratic Oath. Like, of course, he decimated the Hippocratic Oath. And like everyone said before, he sounds like a psychopath. He sounds like antisocial personality disorder, does not care who he hurts or how he hurt them, and it was intentional. It wasn't an accident. It wasn't like, oops, I accidentally put this in the wrong, like, this was intentional. So, exactly. Let me highlight your comment again. How many people have to die for something to happen? And that's the sad part, right? That even one person had to die before this was investigated. And the fact that it was an anesthesiologist that just was healthy at home and connected herself to an IV bag, that's what prompted all of this. The scary part is, how many more patients would have had to die at that facility, right? 10 had like unexpected cardiac emergencies, right? How many more does it take to be like, something off is going on? All of a sudden, all of these events are occurring. So that's my 2 cents. I don't, but the Texas Medical Board needs to step it up, because they're not doing it. They're just not doing their job. And if you do watch that show, it's on NBC's Peacock app. It's just, I just can't believe it. Like, it took whistleblowers to basically beg and plead so that this other doctor, Dr. Dunch, didn't perform any more surgeries. It's disconcerting. It's scary. But anyways, so that is today's. Let me know if you would like me to do more videos on medical negligence. It will not always be physicians, right? There's nurses that unfortunately also do medical negligence. Let me know if you would like a Q&A session on like nursing or what I've done so far, like in my career. I am all ears. I'm open for suggestions. And for those of you that tuned in, thank you so much for watching. For those of you that are watching the playback, make sure you drop a comment below. Let me know what you think about this case. I mean, it's just so sad. Such a tragedy. Anyways, make sure that you hit the like button, that you subscribe, and you turn on that notification bell. Until next time.